Our pilot research study is around enhancing the extraction of health-related social needs, or what we sometimes call social determinants of health data, from electronic health records. The motivation for this study has always been, how do we improve providers and clinicians' access to relevant information that's really important to patients' health? And health-related social needs like food insecurity, financial instability, housing issues, your ability to get transportation, all negatively affect patients' health. They complicate care delivery and make things harder to get people effective treatment, and they drive costs and utilization. There's a big push in terms of national policy to increase the measurement and use of these data sources. This study really fits with one of my areas of passion, and that is, how do we take data and use it in new and interesting ways? How do we really squeeze the most value out of all the data we already have? And our study is really focused on looking at textual data. So much information on patients is recorded in notes and text, but it's hard to get. And so this study is really saying, how do we go in and systematically, effectively, and fairly extract that information, standardize it, and turn it into structured data so we can use it in analytics, in decision support, in reporting, in dashboards, in decision making, and then turn around and get it to the decision makers who can act on it. This study fits within Regenstrief's strategic plan in a couple of different ways. First, Regenstrief is committed to and very focused on equity. Better information can help organizations identify policies, practices, resources to address some of those inequities in health. Second, the Regenstrief Institute has always been at the forefront of standardizing and thinking about the best ways to use data. And that's what we're trying to do also in this study, is taking that information we extract, but then follow national standards so that we can then better apply this information. We are going to make sure that these algorithms work well in a wide variety of patient populations. We're going to be focused on high-risk populations that our community partners serve, and we're going to be focused on those populations with specific conditions that are of interest to our Regenstrief investigators. We have been building these algorithms for quite some time, and we're really excited to push them further in this project. This project will result in a couple tangible outcomes for our community partners as well as investigators at the Institute. On one hand, we have IU Health. IU Health has been really thinking systematically and comprehensively about how to deal with patients' health-related social needs. We've been very fortunate to work very closely with many members of their organization who are working to improve screening, to improve reporting, to improve use of this data. The second partner we're very fortunate to work with is the Indiana Health Information Exchange. They have immense data resources, they have access to this data, and they are interested in working with us because it's a way to add value to the services they have, and they're the ones who can actually push this information out and make it more accessible.